But Kamichi is in the lead and human rights at the center. The world can end AIDS as a public health threat by 2030. This is coming from experts who met in Abuja ahead of the commemoration of World AIDS Day. TVC News, Kemi Balogun reports.
The progress made in the HIV response is directly linked to progress in protecting human rights and strengthening health systems. This year, the advocacy is on the reduction of mother-to-child transmission, which still remains a significant challenge. Experts say ending AIDS requires that everyone living with or at risk of infection, especially those excluded or marginalized, are reached. Esther belongs to an association of women living with HIV and AIDS in Nigeria. She says a world that gives more support services to women and their babies will be a path to ending HIV in Nigeria.
This is the right time for us to start looking at how to bridge that gap, to ensure that all children living with HIV and AIDS are on treatment and receiving comprehensive care and services. But to achieve that, we also need to ensure that the mothers, which we are still at 50% of treatment and care, that they are being provided an enabling environment, have comprehensive care and support services.
163,000 children are living with HIV in Nigeria. The National Agency for the Control of AIDS says Nigeria is committed to ending pediatric HIV infections through the launch of a national level observation committee across the 36 states and the FCT.
We must empower every individual, especially women who are most vulnerable to contracting the HIV disease and other vulnerable populations, to access life-saving services and live with dignity.
Experts here say the world can end AIDS if everyone's rights are protected. But there are still gaps in the realization of human rights for HIV services, further threatening the progress made.
A lot is being done to ensure that we can find all the pregnant women, test all of them, link those who are positive, so to treatment, and then report us.
We cannot afford to leave the most vulnerable populations, including women, children, and key populations, out of the HIV response. Equity should be ingrained in every aspect of our programming.
This year, the focus of the event is on sustaining the HIV response and stopping HIV among children in order to end AIDS in Nigeria by the year 2030. Kemi Balogun, TVC News, Abuja.